Post-traumatic stress disorder, PTSD. Understanding and overcoming trauma. What is PTSD? Post-traumatic stress disorder, PTSD, is a severe and often debilitating condition that can develop after an individual has experienced or witnessed a traumatic event. This disorder is characterized by symptoms such as flashbacks, nightmares, severe anxiety, and uncontrollable thoughts related to the traumatic experience. While PTSD can feel overwhelming, it is important to remember that recovery is possible with the right support and strategies. Understanding PTSD, the symptoms and impact. PTSD manifests in various ways, often disrupting a person's daily life. Flashbacks are perhaps the most well-known symptom, where the individual feels as though they are reliving the traumatic event. This can be triggered by specific sights, sounds, or even smells that remind them of the trauma. Nightmares and intrusive thoughts also frequently occur, making it difficult for sufferers to find peace or rest. The anxiety associated with PTSD can be intense, often leading to avoidance behaviors where the person tries to stay away from anything that might remind them of the trauma. This can result in social isolation, further exacerbating feelings of loneliness and helplessness. Dr. Bessel van der Kolk, a renowned psychiatrist and trauma expert, emphasizes that the body keeps the score, meaning that trauma is not just a psychological issue, but can also manifest physically through chronic pain, fatigue, and other symptoms. The path to healing, treatment, and support. Healing from PTSD is a journey that requires time, patience, and the right support system. Therapy is one of the most effective treatments for PTSD, particularly cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR. These therapies help individuals process the trauma in a safe environment and develop healthier coping mechanisms. Dr. Judith Herman, a pioneer in trauma recovery, highlights the importance of a supportive community in healing, stating, "Recovery can take place only within the context of relationships. It cannot occur in isolation." Surrounding oneself with supportive friends, family, or support groups can make a significant difference in the recovery process. Moving forward, building a life beyond trauma. Living with PTSD does not mean that you are doomed to a life of fear and anxiety. Many people have not only survived but thrived after trauma by finding purpose and meaning in their experiences. This might involve engaging in creative activities, volunteering, or advocating for others who have gone through similar experiences. Resilience is key, and it's something that can be built over time. Dr. Viktor Frankl, a Holocaust survivor and psychiatrist, famously wrote, "When we are no longer able to change a situation, we are challenged to change ourselves." Embracing the process of change and growth can help transform the pain of PTSD into a source of strength and empowerment.